Good morning. I'm Dr. Jared Roscoe, and today we're going to be talking about oxygen therapy and the diabetic patient. All right. Quick word about who I am. So I'm a doctor of chiropractic medicine. I graduated with research honors, finishing my medical doctorate this year as well. And previously I practiced at the United States Department of Defense, where I treated members of President Obama's cabinet. And currently I practice in Florida, as Dr. Lyons said, where I have an integrated medicine practice. I'm also a certified Kaqun specialist. Okay, so as we all know, Kaqun water is an oxygen delivery system. Very high levels of dissolved diatomic oxygen is present in this base that we use to basically apply this therapy to the human body. I won't spend too much time on this, but I do want to say a few words about this. How important is oxygen? We heard a lot from Dr. Kaqun and from the other presenters, but let's just say a word about this. So in studies where we look at the gluconeogenic effects of the liver and the kidney during fasting, they'll have the patient go maybe 30, 40 days without food. Water's a bit of a different scenario. 6, 7 days is about the maximum that the human body can go without water. Oxygen, however, the body's dead in seconds. Okay, it's that vital. Interesting study here that I referenced, the biochemistry of metabolic-induced acidosis. We won't get too much into the biochemistry today. It's a little bit more of a clinician's point of view. But here they do reference how the body becomes acidic, we have a lack of ATP production, and basically the cell dies in a matter of seconds. So oxygen's absolutely vital. Okay, so let's just define some terms. I just want to spend a minute on this. So diabetes mellitus is kind of the heart of the presentation today. Just to clear up the word, why is it called this? Well, diabetes is basically the term for to siphon or to sift through, and it's named this because when this disease was first basically categorized, what the doctors were noticing was that the patient was passing copious amounts of urine, something we call polyuria. And the reason for that, which we didn't understand at first, but the reason for that is, of course, elevated blood glucose levels, and as that pertains to the osmotic gradient in the blood, pulling water out of the tissues, which, of course, the patient would pass in the kidney. So that's where the term came from, diabetes. Mellitus simply means sweet, and that's because there's a great deal of glucose in the urine. So according to the World Health Organization, I want to give you a fast definition. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. We'll talk a little bit about that as we go on. Definition I like a little better personally. Diabetes from the International Diabetes Federation. Diabetes mellitus represents a spectrum of metabolic disorders and has emerged as a major health issue worldwide, especially in the United States. This is rampant. I think 1 in 3 or 1 in 4 at some point in their lifetime in the U.S. at least will develop a diabetes diagnosis. It's quite a problem. Now, there's a point I want to make here that's very important. Now, we mentioned chronic hyperglycemia, which is high blood sugar, diminished insulin production, but here's really the hallmark. Here's what you have to understand about this. Impaired insulin action. Now, you can have a combination of all this, but the point we're really going to hit on today, and what you really see in these patients, is that the cell won't accept insulin anymore, and that's what we're going to hit on today. Okay, just a little more nomenclature and whatnot. Basically, it gets broken down into several different categories. Today, what we're going to talk about is type 2 diabetes mellitus, okay? All right, so let's get into it here. So the mechanism, what's actually going on inside the cell in these patients? Phenomenal study here in the Journal of Redox Biology from, about 2 years ago, 2017. Mitochondrial dynamics in type 2 diabetes, pathophysiological implications. Okay, great study here. What the authors are actually talking about here is the fact that when mitochondrial dysfunction occurs, when you actually get a decrease in the cell's ability to metabolize substrates such as glucose, fatty acids, amino acids through as we can actually metabolize amino acids as well, gluconeogenic, what actually occurs is, as a protective mechanism, the mitochondria will stop burning these fuels, and actually decrease the expression of the GLUT4 receptor, which is the insulin receptor. So what the cell will actually do, because you can't have a buildup of glucose inside the cell. So once the cell loses that ability, which again we're going to talk about a little bit more here, but once the cell loses its ability to process that glucose, more or less to protect itself, it stops accepting insulin. So it's a very important point to understand here. So there we are again. This is confirmed in this study here from actually brand new study. This is November of 2019. They're talking about hepatic insulin resistance, again, induced by mitochondrial oxidative stress. Same concept here. They talk about the blood sugar rising as mitochondrial function decreases. Very interesting concept. Again, what they touch on is that common mechanism of that underexpression of the GLUT4 tyrosine kinase receptor, which again is the insulin receptor. So they do go on to talk about other biochemical means here, the carnitine shell. This is just basically fatty acids and how they're metabolized. But the bottom line is that as the mitochondria lose their ability to perform their role, insulin levels rise, blood glucose level rise as well. So what we know off the bat here is that we're looking really at a mitochondrial disease when we're talking about type 2 diabetes mellitus. Okay, so let's talk just a few words here about oxygen therapy, which again we said Kaqun is a form of oxygen therapy. So very important study here. Now they're using HBOT here, which is a hyperbaric delivery of oxygen. But what these authors are showing here, this is another excellent study where they're talking about improving insulin resistance in humans. They mentioned the same mechanism. What's actually happening when you supply deficient oxygen to that cell, you jumpstart the mitochondria. And we're going to touch on the biochemistry behind that in just a moment, but what the cell actually does in the presence of oxygen is the complex biochemical pathway, which we're just about to talk about, will actually speed up, if you will. It'll start to produce ATP again, which, as Dr. Kaqun said and the presenter before had mentioned, what's actually happening when mitochondrial function drops, ATP production drops, right? That's really the common goal of the mitochondria, is to produce sufficient ATP for the cell. These authors mention the same mechanism here, that the insulin receptor is decreased or not expressed post-study, and then as they apply oxygen therapy, what actually ends up happening, ATP production goes up, the oxidative phosphorylations increase, and what you actually get is what they call, peripheral insulin sensitivity is improved in these patients. It's quite remarkable. Okay, so again, a couple great studies here. Again, we're using HBOT, not Kaqun water, but again, from a clinician's perspective, Kaqun's very, very effective at this. And again, we're looking at insulin sensitivity and how it's improved in overweight men with and without type 2 diabetes. Remarkable study. What the authors go into here is, what are we using glucose for in the cell? And it's important to understand this. Whether this substrate is a fatty acid or it's glucose, or we said we're going to take an amino acid, what the body's doing ultimately through these complex pathways, and I love how, I believe as Dr. Kaqun said, it seems so complex at first, but yet it's also so very basic in its own right, is the fact that, if you look at these complex biochemical pathways, the glycolysis, going into the pyruvate dehydrogenase complex to get into the mitochondria, where we have the TCA cycle, also known as the Krebs cycle, and then ultimately, where we're trying to go with this is the electron transport chain, right, the ETC, which is 5 complexes, proton complexes. And what actually happens here seems very complex, very intricate. What the body's trying to do with all this, it's trying to use the carbon skeleton, if you will, of the substrate, the glucose molecule, the fatty acid, whatever it is, simply to get to the point, it's breaking it down further and further, till we can get to the point where we can actually separate the hydrogen from the carbon, right? Once we do that, we can create what's called a proton gradient. Well, why is that important? It's important because this whole pathway that glucose follows once it enters the cell is simply trying to get, there's a few things that occur, but for the most part, it's simply trying to get to complex 5, which is the very, very tail end of energy production, where we take an ADP molecule, adenosine backbone, 2 phosphate groups, and we apply a 3rd phosphate. Now we adenosine triphosphate, right? That's the energy molecule for the body. So, what does this have to do with oxygen? Okay, so what's so very vital to this process is the fact that oxygen sits at that final receptor site, that final complex 5, all the way at the end of the electron transport chain. And it takes those hydrogen molecules, if you will, after they've been used up, and the carbon dioxide as well, and basically it helps us excrete these toxic metabolites at this point. Without that, the cell can't function. ATP will never be produced. I mean, as we said a bit earlier, in glycolysis, you get a few molecules of ATP, but basically the cell becomes acidic and it dies. It's not really, life is not really sustainable in the absence of O2. So, very, very central to our theme today is the fact that the cell cannot produce sufficient ATP. It cannot metabolize glucose really properly in the absence of O2. Okay, so in your diabetic patient, is this mechanism occurring? Absolutely. This is actually what's happening. In the U.S., we don't really look at this too much. I mean, I can't speak for abroad, but generally the standard of care is insulin. You just load the patient with so much insulin that you're going to force the glucose into the cell, which of course creates more reactive oxygen species due to the dysfunctional mitochondria, and just creates a great deal of trouble for the patient. So, central theme here, we need to understand this. Another interesting point that, again, we don't look at too much in the United States as far as what's actually occurring with these patients. So, again, I think Dr. Kaqun mentioned this, but the interesting thing is we'll look at the O2 saturation, right? But that's really a measure of oxygen bound to the hemoglobin moiety intracellularly for the red blood cell. So you're looking at what's in the bloodstream, and you'll maybe see 98% saturation. Well, that's fine. To get this concept, though, we have to understand a little bit of physiology. So in the tissues, right, in the periphery of the body, we have something called the Bohr effect, B-O-H-R. The Bohr effect is what happens. It's how oxygen gets from the bloodstream into the cell. Basically, a switch occurs where CO2, interesting fact, by the way, the red blood cell, the affinity is, I think, many hundred times greater for CO2 than it is for O2. So what actually happens is you have to have that CO2 present for the O2 to leave the bloodstream and the CO2 to leave the cell. Bohr effect, that switch. In the lung, it's the opposite. We call it the Haldane effect. But in the periphery, in the tissue, CO2 is vital to the O2 entering the cell. So you can do an O2 sat and look at the patient's, saturation. It's going to be quite high in most cases. But the key, the takeaway with this is that that's not what matters. What matters is what's intracellular, okay, what's inside the cell. Interesting point with this in terms of mitochondria is the fact that if you have mitochondrial dysfunction, you're not producing CO2, okay? If the mitochondria are inhibited, so to speak, you're not going to produce CO2, okay? If you don't produce CO2, the O2 cannot get into the cell. So it's kind of a dwindling spiral with these patients. They get the mitochondrial dysfunction, they can't produce ATP, they cannot produce CO2, and at that point it gets even worse because now O2 cannot get into the cell to an even greater degree, and you see these patients, their health dwindles. It gets worse and worse. So another study here we need to look at, again, HBOT, but still, in terms of oxygen therapy, it's correct. Basically, in this second study here, with the effects of hyperbaric exposure with high oxygen concentration, we're looking at the same mechanism. Glucose levels falling, and basically symptoms dissipating. This is actually quite interesting in this study. Now, this is a rat model, but still, what we're looking at here is they actually had resolution of certain symptoms, such as diabetic neuropathy and diabetic retinopathy, actually, in some of these rats. So, again, oxygen to the cell is vital. Oxygen to the mitochondria is absolutely vital. And the takeaway, I want to make sure we get this one point, is that the main show, what are we trying to do with all this? We're trying to produce ATP. ATP, a good way to think of it, is that it's a currency for the cell. It's almost like you can buy new parts with it. The mitochondria can use that ATP to repair not only the rest of the cell, but itself. So that's what happens in these studies when they do apply oxygen to the cell, the ATP levels spike, the mitochondria heal themselves as well as the rest of the cell. Okay, so pardon the picture, I know it's a bit graphic, but I just wanted to show what actually occurs in terms of actual Kaqun therapy now, this is an actual patient that had what's called a non-healing diabetic ulcer. As you can see, it's quite recalcitrant. These things are very hard to heal in these patients. Medically, there's not a whole lot you can do for them. Very commonly, it ends up in the amputation of the limb for the patient. But after, let's see, about 3 months of baths, you can see here on the left, the tissue is almost completely regenerated. So really quite amazing, and it's beyond our scope today, but this goes into more about how the CD35 positive stem cells are greatly increased in these high oxygen environments with the Kaqun therapy. But another one you can see, I mean, really unbelievable. There's very few things that can do this for the body. So it's a remarkable therapy. I want to take just a moment and go over a case study. This is a patient of mine. So this a 72-year-old female, they came to me with undiagnosed diabetes. We did some blood work, and their fasting blood sugar. Please. A little dry, I'm sorry. So this patient came to me again. We did some blood work, and their fasting blood sugar was in the low 300s. Now, anything above 100 is really non-optimum. The 300s this is dangerous. Okay, this is life-threatening. So the A1C was about 12.4. Now that's a glycosylated hemoglobin reading, basically. And what that's talking about is how much glucose is sticking to the red blood cells. Again, you want to be maybe low 5s on this. This patient was at 12.4. So, of course, numbness and paresthesia in the lower extremity, very common diabetic neuropathy. But this is a serious case. I feared for the life of this patient. Of course, they started insulin immediately, but it was quite recalcitrant. Their blood glucose really only dropped to around 250. Please.
You see, now let's talk about it. One thing to drink that. How important is water? Huh? You see, in European lawmakers, they made a law. They said water is not medicine. That's the law. I disagree with that. I think who made that law, I would not give him water for 5 days. I think it's only one medicine to cure him. But by the 5th day, I think it would be begging for medicine, for water. On the 7th, I read that. Okay. Sorry. We get you out of this.
Thank you. So where was okay. So they had some success on insulin. It wasn't great. Basically, I referred this patient to the Kaqun baths, and they did 3 baths per day, 50 minutes for each bath, of course, and they drank 1.5 liters of water a day. That's it. They didn't change the diet. They didn't exercise, and we're talking over 2 weeks. Okay, that's it. About a week in, the patient started doing their blood sugar in the morning, and it dropped to around 130. Their fasting blood sugar was about 130, which is remarkable. It's remarkable. They took themselves off insulin, which I don't recommend. But they stopped taking their insulin, and the blood sugar stayed the same. Okay? About 12 weeks out, we did some more blood work. The A1C reading gives you about a 120-day average of the blood sugar. So we waited 120 days. We did their A1C again, and we cut it in half.
Wow.
To 6.5, which is just above really pre-diabetes, to be honest.
Oh.
Yeah. That's after 2 weeks. So it's phenomenal. As far as the numbness in the legs, it's drastically better. The patient's actually regaining sensation in their legs, which is pretty much unheard of. I mean, they're, for really any therapy, let alone 2 weeks of the therapy. So remarkable results so far. Really, it's.
Can I have a question? Have you looked at inflammatory markers?
Yeah, we did.
History of inflammatory markers.
Yes, they were quite high. Her C-reactive protein, I think, was about 9 or 10 whenever we first started.
Third week?
Third week was the 3rd week. I didn't look at her C-reactive protein. Yeah, I did blood. Yeah, I'm sure it was decreased, but 3 3 months later, though, I think she was 1.4. I mean, the blood labs came back almost normal after 2 weeks of baths. So, okay, we all know about how Kaqun's administered, of course. I gave the patient the baths and the drinking water.
Nice practice.
Yes, thank you. Very lovely. Okay. The only reason I like this slide, I talked very, very briefly about the contraindications with Kaqun water. Basically, everybody needs this, you know, as we heard earlier, right? But I like this slide because organ transplant patients and maybe, you know, some autoimmune patients do great on this. Severe uncontrolled autoimmune patients maybe not. But I like this slide because the mechanism is the same with these patients. Kaqun water strengthens the immune system so much that, you know, you actually get something called graft-versus-host disease in organ transplant patients. But it really is a testament to the fact that the oxygen really severely bolsters the immune system. So that's the one thing I like about this slide. And that's it. I thank you so very much for your time.